Go ahead.
Good afternoon, everyone. We'd like to provide an update to all of you. We just want to reach out to all the families and organizations that have been so generous to us during this time period. For example, the Director of Nursing's family, she has 8 sisters. They've all provided cookies numerous times, probably made 1,000 cookies overall to our staff. Oh, I forgot, and our sister-in-law too. I don't want to get in trouble. Hamden High Lacrosse girls team made handmade cards for all the residents. Bangkok Boulevard, the Thai restaurant right down the street from us, provided meals for our entire 3rd shift. So many families continue to bring us pastries, cookies, and meals for the whole staff. Again, thank you. It really makes a difference. On the subject of personal protective equipment, we've never been more fully stocked than now, correct?
Yes.
We had a large shipment delivered on Tuesday, and we're doing very well. So all of our staff and residents who choose to wear a mask have whatever they need to wear. Our staff is returning slowly but surely, excuse me, but we still have approximately 17 staff members out, and our staff continues to work doubles and many days in a row to just provide the great care that we all expect at our home here. Again, you've met Robin Mix in the past, our Director of Infection Control, who's been here night and day monitoring this outbreak. And I was just wondering if you could give us an update of how we're doing in the building.
We are absolutely improving on our numbers. We have less and less people that are coming back positive for COVID. We have 2.5 floors now that are no longer housing COVID patients. So we are down to pretty much a very small area. We continue to test some of the people that have been negative before on an ongoing basis because that's part of the protocol. The state of Connecticut and the CDC required that to be able to take anyone off of isolation who was COVID positive, you must have 14 days from the day you tested positive, and you also have to be symptom-free within 72 hours of being taken off isolation, meaning that you can't have a cough for 72 hours, no fever for 72 hours without any Tylenol or any medication that reduces a fever. So we've met the criteria for many residents, and we are very happy that we really have been able to keep a lot of our residents here in their own home and give them the appropriate care that they need. Staff is really pitching in. We are here 7 days a week for anybody's needs so that we can oversee that everything is getting taken care of. It's very important that we feel that the residents feel comfortable and are cared for in their own home. The community in and of itself, Connecticut is seeing a decrease in the amount of positive COVID testing, which is also a good sign. And we are hoping at some point, we have taken a few of our residents back because they met the criteria from the hospital. And we're hoping that soon we will be able to start bringing other residents back into the facility and possibly some of the people from the community.
Robin, now on a daily basis, who do you report to all this information?
There are a lot of reports that we put out on a daily basis. We are constantly updating the CDC site and the Department of Public Health. They want to know how many people are actively infected, how many people are off of isolation, who tested positive, who tested negative, who goes out to the hospital. So they are certainly counting and looking at all the criteria and all of the numbers so they can actually make some educated guess and see how things are going. with long-term care facilities. So we do report frequently. Department of Public Health has been in the facility 3 times already, gone over different criteria for us, helping us to plan for ways to use our PPE appropriately and not waste it, because it's been one of those things where we've had some shortages from time to time. So they've been in the facility to help us look at that and to make sure that we are meeting the best requirements to keep everybody, our staff, our residents, happy, healthy, and making sure that we are not spreading inadvertently any of COVID-19.
So I guess we could assume the Connecticut, the percentages of people testing positive is lowering, and it's happening here too. I think the last time we had a positive case was several days ago, is that correct?
Yes, it actually was multiple days ago, and that was only 2 cases. And we are basically now in-house to the lowest amount of positive residents that are actually on isolation for COVID-19. So we've seen a big decrease in residents having positive COVID, in staff having positive COVID, and even in the community. So a lot of your patience is paying off, because hopefully we're gonna see a really a big decline in this, which is what we are now looking at, and hopefully be able to go into the next steps with eventually with guidance from the state and the government as to when we're going to be allowing families to come in and visit. We do not have any guidance on that right now. We haven't met some of the points that we need to be at. But as soon as we do, we will certainly update you and let you know what the criteria will be and what milestones we need to meet to be able to participate in that.
So as of now, the governor has extended the ban on visitation. As soon as we hear something, we'll let you know. And remember, if it's FaceTime, phone calls, or whatever way you choose to communicate, please call the front desk, 203-288-6230. We'll take a message, we'll get back to you, and we'll try to do whatever we can to make that possible. Again, I thank you. I cannot imagine how you're doing and not visiting your loved ones for this amount of time. And I thank you for your patience and your prayers. And I thank this wonderful staff that I work with every day.
We have a great team, very good team. Our heart is really in this, and we do appreciate all of your patience and your support. It really does mean a lot. This is a very tough time for everybody.
So have a good afternoon, and thank you.